This idea of interrupting the pain cycle or staying ahead of the pain is something you'll hear doctors say, because what happens is we learn pain and it amplifies. So it may be the same level of pain, but because we've become sensitized to it, it feels more. Before we dive into this week's episode, let's talk about a brand we both genuinely love. Cytoplan. You've probably heard us mention them before, and that's because their supplements are next level.
Yes, Cytoplan has been part of my routine for a while now. They just get it when it comes to health. Their whole approach is rooted in science and totally in tune with nature.
Exactly. Their formulas are bioeffective, which basically means the nutrients are in forms your body actually recognizes and uses properly and at the appropriate levels. Cytoplan is used and trusted by health practitioners across the country. Their formulas are developed by nutritional therapists and backed by over 3 decades of clinical insight. You really can feel the quality when you take them.
Plus, it's not just about what's in the bottle, it's the mission behind it too. Cytoplan is 100% owned by a charitable foundation, which means everything they do is about helping people live well for longer. It's not about trends or quick fixes, it's about real, lasting health.
That is so wonderful to know. And whether it's our energy, perimenopause, menopause itself, sleep, immunity, or just staying on top of your health, they've got you covered. You can also get a free health questionnaire and a consultation by ringing the helpline.
So if you're ready to take ownership of your health, check out Cytoplan, powered by nature, proven by science, and rooted in purpose. We'll pop the link and an exclusive 15% discount code in the show notes. Hello, I'm Karen Mellers.
Hello there, I'm Dr. Rosy Daniel.
You've just tuned in to Alive and Loving It, and we're here to help you bring joy and energy back to your life. Hello, beautiful ones. You've joined us again. Thank you so much. Do you know, Rosy, we had a message last week, I think it was, from a lady that said, I start my Tuesdays listening to your podcast.
Aww.
So big kisses to you. It's your Tuesday. It's our Tuesday, and we're here again. So we're episode 48, just a subject that I know a little bit about. Aches and pains, soothing our aches and pains. I think this is going to be a juicy one. Let's go. Rosy, why do we ache in our muscles and our joints?
Okay, so many reasons. And I was staggered this morning to get your message, Evelyn, that you have said that 43% of us, so around 28 million people, are suffering with chronic pain.
Yep.
Staggering. So we have, as well as we've talked lots and lots about our autonomic nervous system, which is on the inside of the body that goes along without us knowing it's doing its thing. But we also have a somatic nervous system, which is the one that is controlling our movements and our muscles, but also our sensation. And we have these little sensory nerve endings everywhere, in our skins, in our joints, in our muscles, that are telling us if things are wrong. Either if things have become strained, bruised, inflamed, or if just somehow the chemistry is wrong. And we also have in our joints sensors for barometric pressure. So in terms of what's going on with the pressure in the weather systems, you know, we see on the weather report that we're going through high or low pressures. And some of us are really sensitive to those changes in barometric pressure. But broadly speaking, you know, the headings that this is under is trauma, obviously, when we hurt ourselves. The autoimmune inflammatory conditions, when we're making antibodies to ourselves. So something is kicking off that's making us actually make antibodies to our own joints or our own thyroid or our own pancreas. Repetitive strain injuries, which happen if people do the same thing over and over and over again. Then there's bad posture and stress, when we get all locked up and tight and, full of knots. Very common. Wear and tear problems like osteoarthritis. And then a very difficult group, which is the myalgic encephalomyelitis, so ME, where people get muscle pains, and that goes over into fibromyalgia. And let's not forget muscle cramps. So there's a big old bunch of different types of pains that we experience.
And do you think the feeling is different for each type of pain, Rosie?
Definitely. Definitely. And I thought you were going to ask me, being an emotional resilience coach, I thought you were going to say, do you think it feels different when we're upset? And I would also have said, definitely, because there are different components of pain, because pain when we're frightened and pain when we're upset can be a great deal more intense than the actual physical stimulus that we're getting.
It's fascinating to me. I mean, what we're talking about is the body is talking to us again. Yeah, that's what pain is. And I feel a lot of pain because of the scoliosis. It's very easy for me to feel lots of different types of pain. It's a little bit like an orchestra to me. So the music is, the pain is music. And sometimes I hear a soft cello, and then other times I hear raging trumpets, So depending on what level of stress or trauma or damage is going on in my body. And I'm just realizing that it's because I have listened for so long that I have learned from my body what the different types of pain are, and some are much worse than others. And I can tell when there's a new one. So yeah, I'm conducting an orchestra here, and I have to listen very closely to which one it is. And the one that happened on Sunday, when I was sat down on a chair like this, and I'm not going to do it, but I twisted to the right and I bent down and something went twang in my right look. That was a new one. But, as always, we're going to talk about the hope behind this, because I was told at the age of 14 I would have to live with pain all my life. I do feel it a lot, but what I have learned is the ways how to stop the pain. And there's many, many different ways that you can do that. So I'm looking forward to us having a discussion about that.
Well, as you say, Karen, you are again living out the episode for us.
Yes, I'm so in tune with the themes of this podcast. It's unbelievable.
And I think it's also important to put on the map that different parts of us are much, much, much more sensitive than others. So, the amount of sensory nerve endings we have in our face, in our lips, in our tongue, massive, massive. But other parts of the body less so. And for example, where we're wired up very accurately with our skin and our muscles and joints, the inside of the body can be much less specifically wired up. So for example, if a person has a swollen, hurting liver, often they feel that pain in their left shoulder.
Really?
Yeah. Yes. So this is a referred pain. And everybody knows that a heart pain, a heart attack pain, people can feel down their arms. So this is where, when you learn medicine, you have to get tuned into what are these signals, and where are they coming from?
Yeah.
Yeah.
I mean, there's some research going into the menstrual cycle, and how acutely, or how pain can be dulled and how it can be really acute, and does the kind of tone of the tendons and ligaments change as well with your cycle? I mean, it's endless, isn't it?
Well, I think with our cycle, but there's also a point in our midlife, around perimenopause and menopause, when the ligaments soften. There's a hormone called relaxin, and very often that can be a time when somebody gets a slipped disc, because those ligaments that normally hold everything tight and well structured may be softer. Yeah. Yeah, but as you would expect me to say, the key is using our bodies and not just exercising hard and being tense with exercise, but all the beautiful, the yoga, the tai chi, the qigong, the things where we soften and stretch and increase our flexibility, as well as doing the cardio that strengthens our muscles and joints.
And actually, I swear by Pilates, but not like hardcore Pilates, really just focusing in mind-body connection to those core muscles and your pelvic floor. When you pull up from your pelvic floor and you go across hip to hip and then start coming up, if that part of your body is strong internally, that'll really help protect your lower back and your mid back as well from getting damaged. I don't know why in my body all other muscles will go into spasm except my abs. And I keep saying, why can we not have the abs in spasm, please? Because I'd be happy with that one. But that's the area that tends to relax. And, if we put a bit of weight on and fat stored around there as well. So that's an area I would really recommend that people concentrate on.
Yeah, well, I think these systems that have been devised are just so brilliant. It's said with yoga that it was originally designed to stretch and strengthen every single nerve, tissue, ligament, organ in the body. But there's also Feldenkrais and Alexander technique. Alexander looked at the way that, I think it was a gazelle, they don't have rounded shoulders with their heads hanging down, they are in perfect alignment. And I've started noticing I never sit back in a chair. I always sit up. And maybe that has come from years of doing yoga.
Everybody's shuffling back now.
But, the point is that our head is incredibly heavy. I can't quite remember. It's about 3 kilos or 4 kilos, something a lot, like the weight of a baby, And so if it's in balance on the top of our spine, we don't feel that weight at all. But if it's hanging forward, then it's putting a heck of a stress. So this thing of finding our perfect posture and alignment, which is at the heart of Pilates and all these other self-help modalities, is just so beautiful and key.
I have a treatment once a month called kinetic chain release, and they are very, very subtle. There's 30 different trigger points that the therapist does for me, and they're very subtle and they're not painful. But the homework I have to do is exactly that, sort of shoulders down, and you move your head back and you swallow. So your head's not up or down, but you swallow, and it's very good at relaxing all of the neck muscles. Because you're right, if we're on screens a lot, on the phone, even on the computer, our head goes forward, and that strains all of the shoulder muscles and the neck muscles. And she said 1,000 times a day, if you can do that, you're on to a winner. I don't know whether I can do it 1,000 times, but you're retraining your natural position.
Well, exactly. I do think for all of us, the position of our computer screen is absolutely key. Mine sits, I've got one of those desks that you can lift up, and the actual screen is sitting on a tree trunk, like a log, so that I'm looking up. Yeah, and I've seen advertised on Instagram laptop stands, so that you can be not having your laptop down on the table, but you can actually be looking straight at your laptop. Yeah.
So am I right in saying then we can feel pain for a long time? I've heard you call that chronic pain. Evelyn. But there's hope. We can do something about it. So what is this term chronic pain?
If you look online, there's several definitions, aren't there? But it's pain that's longer lasting than about a day, a week, a fortnight. I mean, I term chronic pain as over a month. I don't know what you do, Rosie.
Yeah, similar, because something's definitely wrong. If a pain is going on, persisting in that way, there is definitely something happening.
So I just want to say, hand up, I was there at the beginning of this year, and it was going on for a long, long time. And what I experience in that moment is that pain can take my spirit really, really low. So we're now 6 months on, and I am not in that pain. Anybody that's there right now listening to us, my heart goes out to you. But there are so many things that you can do to listen to that pain and to help yourself, and it will get better. It will get better. So just sending love to people, because I know so much that it can take me into a really deep, deep, dark place.
Absolutely. Yes, it is very, very demoralizing and exhausting to be living with chronic pain. And the beautiful Claire Palmer, who gave us her episode about her for herself living with fatigue and pain, is somebody who is saying, I still have the symptoms, but how I feel about it and how I resource myself is to get myself into balance is completely different. Yeah. So she's saying that I now have my condition, but I am well, and it's subtle, but such a beautiful perspective, isn't it? To be able to find that balance. But I do think certainly when we are in pain, releasing the emotions, just actually, whether that's to cry, to be angry, even to scream, to give voice to the pain is fantastic. And the other thing is to explore the fear, because quite often pain amps up because people are frightened of what the pain means and where it's going, and will it be with them forever? So giving voice to, you call it naming it, Karen, naming the fears with a coach, with a mentor, with a healthcare professional is very, very helpful. The other really big thing next I want to talk about is acidity. So Evelyn, can I come to you with that question about what you're seeing with regard to pain? Because it must be, as an integrative pharmacist, must be often what people are presenting to you.
If it's not pain, it's physical pain, then quite often it's mental anguish and pain that way. But certainly I do something a little bit strange. I do it with myself and friends and family, and I've started doing it with people coming to me is what kind of noise does the pain make? And I think, Karen, you clearly listen to your pain, but not everyone does that. So when it gives me greater understanding of what people are going through when they put a noise to it. So that normally starts the conversation off at a jaunty angle, and we take it from there. But when I was doing locums, if the pharmacy didn't keep Arnica products, then the health food shop nearby would always do well with Arnica products, because Arnica is a natural anti-inflammatory and painkiller, and it has so much to offer with such a variety of forms available with other helping ingredients. But it's not a miracle worker, but it can really take the edge off pain. And I would normally recommend taking Arnica internally, so in potency, in a dilute form. So that can be homeopathic, or, one of the Weleda meds, which are anthroposophic, or you can apply it herbally and topically on the skin. And I think that outside in and inside out approach touches most pain. And it's not to say this can't be taken along with regular pain relief. It just might mean that you're not putting your liver through such a burden, because you can reduce the pain relief that you're taking that's conventional. So I'm not against conventional pain relief, although there's a lot of reports coming through now which compares arnica with non-steroidal anti-inflammatory drugs. And actually, in some circumstances and instances, they are comparable with each other, which is phenomenal that we've got the evidence there now, and the pathways are more understood now how it works. But that gives me hope, because the side effect profile for many arnica products is more favourable than non-steroidal anti-inflammatories. And speaking as someone whose digestion is a weakness with me, then I will opt for something which has fewer gastro side effects than conventional pain relief with non-steroidals.
So for people who don't know what a non-steroidal anti-inflammatory is, that would be the aspirin group, the ibuprofen, all these kind of things that you can buy over the counter, which are very helpful, but they can be irritant to the gastric lining, as you're saying, Evelyn. But the other thing that I did not learn at medical school, but that I learned over the last 20 years, was this whole question of acidity in the body. Now, the Ayurvedic doctors, the Indian Ayurvedic doctors, if you open any textbook on Ayurveda, usually chapter 1 is talking about acidity in the body. And, when I went out to India to learn from Ayurvedic doctors, and they showed me people getting well again and staying well after a cancer diagnosis, my teacher said, the first thing you have to do, Rosy, is get your patients alkaline. So I took note. I'd been resistant and reluctant because it seemed far-fetched. It seemed, on top of asking people to stop dairy and meat and coffee, now I was saying, perhaps oranges and tomatoes are a problem. I didn't have the heart to go that far. But once I'd been thoroughly told by my Ayurvedic teacher, I started taking notice. And they got me to measure salivary pH of my people, the closest approximation to tissue pH. And in my clinic, if there was somebody there coming to see me with cancer, somebody in their family, and me, the person with the cancer was way more acidic from the salivary pH. So then I met a young woman. You may have heard me say this before. She was only 36. She had such severe arthritis that she was on all four levels of medication: non-steroidal, steroidal, gold, and methotrexate, which is an anti-cancer drug, because she was having so much, her body was busily attacking her cartilage. So I said to her, stop having all acidic food and drink. So by which it was, the sour alcohols, the sour drinks, the sour juices, excessive tea and coffee and lemons and vinegar. Anyway, I saw her 6 months later, and not only was she not in pain, she was off all 4 medications, and she said that her consultants couldn't even see the arthritis on her CAT scan. So this was just unheard of. I had never heard of this. Anyway, I saw her a year or so later, and she said, oh, it's coming back again. And I said, well, what have you changed? And she thought, and she said, oh my God, it's tomatoes. I've started eating tomatoes again. And then she remembered that as a little kid, she'd had tummy reactions to tomatoes. So, the acidity picture nowadays, if I see people with any inflammatory condition, whether it's joints or skin, eczema, psoriasis, or gastric inflammation, I think we started there with you, Karen, cutting the acid food and drink out of the diet is pivotal.
Yeah, because the road I was going down was, I've got pain, I've got inflammation in my joints, I'll take ibuprofen, and then I'd got stomach acid and my stomach was upset, so then I was taking a drug to help with the stomach acid, and it just goes on and on and on. I mean, I do know that pain cycle of I feel pain, therefore I go into fear, my spirit drops, and so I feel more pain. Because when we're in fear, our body's not open and relaxed. It's usually constricted. And what happens with me is that my shoulders come forward like this, and lo and behold, I start getting back pain. So that pain cycle is really difficult to get out of yourself, which is why then I always go to one of my health angels, including the GP. And this time earlier in the year, I went to the GP and they prescribed the really, strong painkillers. And I did take them for a little while. And the reason why I did is because one of them said to me, we have to break this pain cycle. And that's what these drugs, very short term, are good at doing. Be out of pain for a bit, start to sleep better, spirit rises, fear goes away. So there's a whole program after the initial breaking of the cycle, which includes a lot of relaxation and meditation. And the big thing for me when I started going on the releasing of the pain was I was yawning all the time. It was like I had just held this tension in my body for months, and the release was really big yawns, particularly when I was doing yoga. And every single time I yawned, my muscles just relaxed a little bit further. So, again, I don't think there's anything wrong by taking them short term. And I used to. And I used to get in trouble by going, I'm not going to take drugs. I'm not going to take drugs, because there was more and more stress in my body because of that. But then now I learn very quickly, where's the pain coming from? What is it trying to say to me? And the mind-body connection of what stress is this linked to? And that's a fascinating journey.
Well, absolutely. Tuning into the message of any symptom can give us so much. And, with art therapy, people can even paint the pain and see what the message is. But that thing of in pain medicine, this idea of interrupting the pain cycle or staying ahead of the pain is something you'll hear doctors say. Because what happens is we learn pain and it amplifies. So it may be the same level of pain, but because we've become sensitized to it, it feels more. So that's why always you'll hear people with chronic pain being told, don't wait, and see how much pain you can bear. Take some meds to stay ahead of the pain. Yeah, but I'd like to focus us into this whole question of inflammation and autoimmune illnesses, where we're actually making antibodies against ourselves. This is a big thing that's going on in society. There are many, many autoimmune diseases, and what a strange thing that is when we are, instead of these antibodies being about detecting a foreign body, a bug, an injury, a splinter, or whatever, we're actually making antibodies to ourselves, to our own cartilage, to our own organs and tissues. But this is where medicine is starting to break through, because even this week, there's been talk of the way that they are starting to understand the way that our B cells and T cells are affecting each other and talking to each other. And they're learning how to modify this so that this stops. So absolutely incredible. And also there was a Nobel Prize the last Nobel Prize for medicine was in the space of autoimmunity. And guess what? At the heart of it, they said that it was when people were frightened that this balance in the immune system went out of whack. In our T cells, which are there predominantly to fight virus and cancer, we have T suppressor and T helper cells, which should be in balance. And then the B cells are busy there to fight bacteria. But they're now finding that if they can modify this B cell response of making antibodies to our own tissues. So medicine is really leaping forward in this area of autoimmunity.
Wow, that's such good news, because I think there are so many people who have been diagnosed with an autoimmune that have just been told there's nothing they can do about it and go away and live your life the best that you can.
And take
So,
steroids,
and take steroids and yeah.
which dampen down the immunity, which you need to not have bugs and to not have cancer and, to get rid of these toxins. But there's another thing that Dr. Sarah Myhill, amazing doctor who's focused in the very tough area of chronic fatigue and fibromyalgia. She has a theory that when our gullet, our esophagus, is affected by candida, which is yeast infection, that it can make the gut more porous, and that larger molecules, she calls it leaky gut syndrome, others do too, and is saying that larger protein molecules are going through than should do and getting lodged in the muscles and creating all this ache. So what I found with you, Karen, when you were getting treated for that Helicobacter infection in your esophagus, how almost immediately many of your aches and pains stopped.
Yeah, they did. Yeah, that week I was taking the strong antibiotics, I felt so much better. And my appetite came back. And, my mouth watering came back at the thought of food. And it's been an upward spiral since there. So I've had to put some probiotics back into my gut. I still don't think it's absolutely right back where it was. But then what I then started to focus on was the mind body connection of what is causing me stress and causing me to release stomach acid. And I went back to my homeopath, who I've known now for 20 some years and has got records on me like this deep. And she reminded me, she listened to me through the consultation, and she was the one that spotted the mind-body connection, not me, which is why I always advocate, if you're going to try homeopathy, go to a homeopath and have a consultation. It's part of the healing. And now I'm able to spot the people and the situations where I go into a trigger of stress and my stomach shoots out stomach acid. It's incredible. I've tested it. And so the homeopathic remedy is now helping me release that pattern. So I would say, Rosy, now from the beginning of the year, I'm probably 95% better now. No aches and pains, no inflammation. Very little stomach acid unless I'm with these particular people. I'm not naming who they are.
No one on screen, I hope.
Yes, not on screen, no. But that's what I mean about it being a fascinating journey. I tell you what I needed to get out of was the mindset of, I'm in pain, so I'll take a pill and that's going to fix it. I would never, ever say that to anybody, because that's, making you think that there's a miracle cure out there. There isn't. It is a journey to understanding, the behavior, isn't it, Evelyn? Yeah.
Yeah, it's more interesting to go back, isn't it? And to find out what the trigger is. It's fair enough treating the consequence of it, but actually going back to the trigger is far more sensible and, yeah, has got wings.
Yeah. I mean, I think food sensitivity itself, a lot of people I seem to be tracking back to the digestive system again, but sometimes the IgG food sensitivities can be a source of pain. They can be a source of irritation to the gut. And very commonly people have wheat and dairy seem to be the two most common. Do you find that, Evelyn, that it tracks back to the gut quite often?
Absolutely, but I think some people have got zero awareness, and sometimes even a mild skin rash coming through can be food intolerance and a signal and a sign that something is a little bit awry. But being switched on to that isn't in everyone's forefront of their mind, is it?
Yeah, but let's go back to the things people can, what to do when you have a sprain, what to do when you have a trauma, because let's introduce this idea of the difference between when you need heat and when you need cold. Because when you have sprained your ankle and possibly torn some blood vessels, some little arterioles or veins, what's happening is the tissue is swelling up. And then if you put a cold compress onto the area, you can stop all the bruising being so bad. Is that something you would advocate, Evelyn?
Absolutely. So, I mean, there are cooling gels. There you can use a cool compress. You can exaggerate the time of contact of cooling products along with the temperature of them. So you can use ice packs or cool packs on top of like a cooling gel formula. But some people naturally resonate. They like to have cool against a cold. You'll get, there are two camps. There's one that says they really like coolness to modify or to empower themselves to take their pain away. For us others, that's anathema. It's got to be warmth. But certainly initially when there's acute trauma, then yes, your body shuts down the blood supply to that area anyway, doesn't it? Or the muscles round about it to protect the area of injury. So yes.
So Karen, you were saying that's you. You like cool. You like
Yeah,
cool.
I love cool. Yeah, and the osteopath I went to yesterday, he was yes, from South America, from Rio. So he's saying to me, no warm, no hot, ice, ice, ice all the time. So I've got an ice pack, one of those that you put in the freezer, and then it goes into a little strap that I can wear around my middle because it's my right buttock that's got the problem at the moment. And then I love this one, which hasn't been out that long. This is the Weleda cooling gel cryo, which has got the menthol in.
Cryogel. Yeah.
Cryo gel. Yeah, that's got the menthol in as well as the arnica. Because I really do like that cold feeling. When I go for acupuncture, she puts Tiger Balm on, and it's a real menthol Tiger Balm that, like, she will explain it as though it's drawing out something. I'm not quite sure what she means there, but I just love the feeling of it. And it really does help me. Yeah.
Fantastic. And then, when there are times when you definitely want warmth. So if I get, knotty shoulders after overworking, then to have heat and gels that create warmth, that heating feeling is so, so soothing.
That was better for me for the inflammation pain. In the end, I've got a jacket that you put on, and it comes all the way around my neck, and then I tie it around my middle, and you plug me in, and it heats up. And I think with that, that's really good for the emotional pain of it all, because something warm, something soft, being wrapped up like a hug, that all helps me de-stress and relax. And that's such a good feeling. Yeah, comforted. That makes
Yeah, I think you're right. I think often inflammatory pains are hot pains and need that cooling effect. In Oriental medicine, they talk about symptoms either being jitsu or kyo, and the jitsu is hot, fiery, pulsing, shouty symptoms, whereas the kyo is empty, damp, cold, and where you feel all emptied out. So I think if we listen to that, we can tell in ourselves which type it is. And certainly we touched into the thing of cold plunging. There are people with chronic muscle aches who do find the cold plunging really, really helpful, and that they can get a reset of their symptoms. I think it's a very brave thing to do. None of us are attracted at all to this
No,
idea.
I actually cannot think of anything worse than plunging into cold water. So I'm definitely in the other camp. I'm in the camp with oils and ointments and salves that generate warmth, and with some rosemary thrown in to encourage the the movement of warmth and with massage to encourage movement. And I had a frozen left shoulder, Rosie, and I didn't ask you about it. And you're saying about your liver. I just think that's fascinating. However, now I know. I had a frozen shoulder, and using a massage balm with a heat pad just lets the heat, is longer contact time and it's warmer, and it just seems to permeate to the area where there's pain. And yeah, it's such a relief.
Very, very common. So these big muscles that go across the top of our shoulder, for many of us, turn into sort of rocks. I don't know about you two, but and what we have flowing through there is all of the nerves that are coming out of our neck in the brachial plexus and forming the nerves that go down our arms. And I caught myself this last couple of weeks with a pain just down here at the insertion of the deltoid muscle, where it goes into that point at the halfway up your upper arm. And I've been putting the arnica and another thing I love called physio creme, which is amazing, down here. And then I suddenly thought, okay, put your brain in gear, woman, that actually it was because the nerve was trapped up here. And they say that about a lot of these frozen joints, that it's the fact that the nerve supply and the blood supply to that joint is blocked because of muscle tension. And whether that muscle tension's in your neck and your back or down in the lumbar, an awful lot of symptoms. And you think about it, I've mentioned before that the nerves of our parasympathetic nervous system come out at the neck area, C1 to C7, and right down in the sacrum. And then our sympathetic nerve roots come out across the thoracic and lumbar spine. Well, how many of our gut problems are to do with the fact that we've got tension in our spine? That it's not often thought about. So I do think that going to have an osteopathic check, I know there's a spectrum from the craniosacral osteopaths who work with very, very delicate touch. Their fingers almost just speak nerve and muscle, and they're working up in the neck and down in the sacrum with these, just activating the parasympathetic system. Then there are osteopaths who are working at a more macro level with the joints and the muscles. And then there are chiropractors who are also trained to use X-rays, so it's going a bit more medical. So that there are different kinds of therapists, but I think having a free, flexible, strong spine is really key.
And ultimately, Rosie, changing your behaviour that led to the muscles getting tense. I keep referring now to last year as the big freeze with me. The last few months of traveling around nomadically, building the house, I was getting more and more frozen. And this year is the unfreeze, and it takes time. So I have had to change my behavior and also have treatments and live by the arnica and take arnica as often as I can to help the unfreeze rather than the behavior that was causing the freeze. And that's the difference, I think. When you were talking about Claire Palmer, and her episode is amazing because she will get these symptoms back, but she knows that it is her body that's telling her she's going into behaviors that are causing that again. So she changes. That's why she described herself as being well. She listens to her body and she changes the behavior, because we have to catch ourselves all the time. Yeah, so the unfreeze can take quite a while, but it's a beautiful journey because it's filled with behavior that makes us feel peace and relaxed and open. And I must say, though, when you start that journey, it can feel a little bit worse at the beginning, because as you start being when you're frozen, you're probably closed and all your emotions are closed as well. And then as you start opening and relaxing, you can get a wave of emotion. That is normal. It might feel worse because you're not used to it, but it is absolutely normal and it's healthy. And then, you know, after a month or so, you can start to feel so much better.
And I think that defrosting process, it can go very deep and be very long standing, because we can have taken a kind of become frozen at a very young age. And I think that what's happening in the groups you run and in the sessions that I run and the trainings I run, I can see people melting those layers of defense and guarding and holding that they've been holding for years. And often, exactly as you say, that with that comes deep tiredness. Because, you know, that silly thing people say, it's only my stress that's holding me together. You know, that when we've learned those grips, those patterns of tension over so long, feeling safe enough to actually defrost is something that we see happening, don't we, Karen? And yeah. Great. Oh my goodness. And I wanted to mention that I first heard that the way arnica was discovered was because apparently the Swiss mountain goats, when they injured themselves, would go and find the arnica plants.
So they knew about the NF-kappa B pathway, didn't they?
Instinctually, yeah.
Clearly.
Yeah. And isn't the arnica about to be harvested around you, Karen?
It is, yeah. So I live 20 minutes away from a nursery called Pointsfield Nursery that have grown arnica for 40 odd years now. And they supply some of the arnica to Waleeda. And yes, he invited me to start the arnica harvest with them yesterday, but I'd pulled my back, so I ended up in an arnica bath instead.
Using it.
I ended up using it instead of harvesting it yesterday.
Yeah.
But they will be harvesting now for the next few weeks, so I'm hoping to go next week.
Beautiful. And I just to remind everybody that a way of supporting our podcast in our marketplace on our website at liveandlovingit.org, in the marketplace, there is a little Waleeda portal, and all these, the arnica massage balm and the bath milk that you can put in the bath, but also in a foot bath, and all these other lovely things that have been mentioned are over there. I wouldn't be without the arnica bath milk. I think if you are
glorious, isn't it? Yeah.
It is. And if you feel bruised emotionally, you know, that's the beauty, I think, of the arnica. It's not just when you feel bruised physically, it's when you feel bruised and beaten up emotionally. I just find it's so lovely to and causes such relief. Yeah. But I think there's a spray, a muscular pain relief spray as well.
So that spray is a mixture. So quite often you'll find arnica in potency with the likes of rutagrave and rustox. So when you have a mixture, you can quite often cover more symptoms, and you know, like there's bits in there for smaller joints or ligaments or tendons. And the arnica is renowned for being used for muscle ache and for pain and for fatigue. So, but when you have the three in there together, you cover a lot more, because there's quite a lot of overlap between the three of them. So yeah, a lovely mixture, arnica, ruta and rustox. Yeah.
And nothing quite like having a nice wide bandage, an old school bandage to bind your ankle if you sprain it, or your wrist. I think that's such a comforting feeling. It must say something very strange about me. Yeah.
Homeopathically significant, but I'll not go there.
Great.
Oh, wonderful. I'm hoping to share some of the arnica harvest on our social pages when I go in over the next couple of weeks, because just looking at the plant brings me joy. You know, it's got this beautiful daisy-like yellow head, and when you see an entire field of it, you can't help but smile. And up here on the Black Isle in the Highlands, it grows very, very well. It's hardy. It likes the windy conditions, and that's what strengthens the vitality of it. So
If you boing it, it does spring back. And I've always read that and thought, oh yeah, that's a nice story. But actually it does bounce back. You stand on it, it's got a spring in it. So it really is quite tough.
Evelyn, which part of the plant do they use in all these arnica?
It depends. Quite often it can be the dried flowers or the whole plant. So you're talking roots, stem, leaves, flower, everything, planta tota. So you can use, there's probably a bit more of the phenolic oils in the whole plant than the dried flowers. But the whole plant has got healing powers to it. Fascinating.
And it's got quite a following now, Evelyn. It's got quite a few fans, hasn't it?
Well, yes, we have got some famous people who have been renowned to use arnica. I don't know if anyone, I know the World Cup's on just now, but when the Euros were on, the French physios would use the arnica massage oil, which is lovely. But if it had been the British physios and they knew about the arnica massage balm, which is a medicine, it has double the amount of arnica in it. So Mbappe did have a nice warming and slight pain relieving massage at the side of the pitch. But if he'd been a Brit, he might have got some more relief. Who knows? But the likes of David Beckham and Usain Bolt, they're both like huge fans of homeopathic remedies, and arnica must be in that list that they use because it's all about recovery of overworked and tired muscles, really, isn't it, as well as pain.
And prevention, is it good for prevention of muscle strains as well for athletes?
I think if you have like a warming massage before you exercise, if you know that you're going to be doing lots of exercise, then that can help in a preventative way. And certainly if you have, I mean, if you need cooling, then you can have a cool muscle soak and help the muscles that way. So that in some way that's prevention as well as recuperation. So it just really, how you want to use the products, but not to get too fussy about it. If you need arnica, you need arnica, and don't get too fussy about which form. Yeah.
One little tip I've been given recently by the lady that I have this kinetic chain release with is talking about the fascia in the body that covers all of our muscles, and the fact that it can dehydrate and that tightens and then restricts muscles and can cause injury. So the best thing for it is hydration. 4 of the water bottles, 2 litres of water every day. I've been doing that for a couple of weeks and I feel much more mobile. So keeping the fascia happy.
Wonderful.
Wow, that was pretty full, and we're just reaching an hour.
Wow.
And just as we close then, I want to say a huge, huge thank you to Evelyn, who has given up her time and her energy and her wisdom, knowledge to do 6 episodes with us in season 4. And it's been amazing. We've had some great feedback, Evelyn, as usual. Thank you so, so much. And please come back and do more soon.
Yes, well, it's always good fun, isn't it? And I always learn. That's what I love. I always learn every time we all get together. So yes, just ask me and I'll say yes. Thank you.
Brilliant.
Wonderful. Thank you. Thanks, guys. See you soon.
It's so good to know that you're listening. Our community is growing bigger day by day. Now we want to engage with you and connect with you to create more opportunities to learn, love, and grow together.
The first step is to go to our website, aliveandlovingit.org, to join the community. This means that we can communicate with you directly to let you know the details of new episodes, next week's guest preview, and of all the new opportunities that we are creating for you.
And in response to the huge interest that there's been in our inspiring guests, we've created for you on the website an exciting Go Deeper page, giving you direct access to our guests and their services.
And if you're new to the podcast, we strongly recommend that you go back and listen to the earlier episodes, because we have some of the most inspiring teachers, scientists, authors, and therapists of our time sharing their wisdom with you.
Our other invitation to you is to become a guardian of Alive and Loving It and join the beautiful group of people helping this podcast and community continue to grow and reach more hearts around the world. If you visit the website aliveandlovingit.org, you'll see our winged heart logo in the top right-hand corner, which will take you straight to our Guardian page on Patreon. And this is a platform designed specifically to support podcast and content creators.
It would mean so much to have you as part of this growing community, connecting with us, our guests, and everything we are building together. And if it feels right for you, becoming a guardian is simply a way of supporting the podcast with a monthly contribution at whatever level feels comfortable for you.
Thank you for being with us. Keep shining, stay true to yourself, and remember, this is your time to live your fullest, healthiest life.
Until next time, keep doing what you love most in life. We are so excited to connect with you on the next episode of Alive and Loving It, and we welcome you very warmly to our Alive and Loving It community.